Good evening. My name is Catalina Lopez-Correa. I am Chief Global Strategy Officer at Genome Canada, and it's a real honor for me to be here. Tonight, I will talk about the power of genomics and how this technology is reshaping the future of our health in ways that are both global and deeply personal. Thank you. When the pandemic hit in 2020, my days and my nights were quickly became filled with genomes. As executive director of the Canadian COVID-19 Genomics Network, or CanCoGen, I was coordinating a $40 million investment from the federal government to support scientists, labs, public health agencies across the country as we worked to sequence the virus that had completely changed all our lives. And suddenly, genomics wasn't something hidden inside high-tech labs. It became part of our everyday language. In living rooms across Canada, people were talking about Alpha, Delta, Omicron, remember? Variants we could identify only because scientists had read and compared the SARS-CoV-2 virus's RNA code. Across Canada, our teams were sequencing tens of thousands of viral genomes to understand how COVID-19 was spreading, how the virus was mutating, and most importantly, how we could stop it or at least mitigate its impact. Sometimes it felt surreal. I would join Zoom calls late at night with colleagues from Vancouver, from Halifax, from Montreal, from Ottawa, all over Canada. And we will discuss the latest variants identified just hours earlier, assessing its national and international impact in real time. Genomics had moved from the lab to the bench, from the lab bench into the news cycle, into the TV, into newspapers, into our living rooms, into our homes. It became part of the social fabric of the pandemic. But that rapid response didn't emerge overnight. It was possible because Canada had spent more than 2 decades investing in genomics research, building capacity, training experts, generating knowledge. Brilliant scientists across the country had been working quietly for years on the foundations of what we and the world now recognize as the genomic revolution. Our efforts during the pandemic went far beyond sequencing 450,000 viral genomes and 10,000 human genomes. They helped decode the pandemic in real time and contributed directly to the tools that changed its course. When we watch almost in disbelief, as highly effective vaccines were developed and validated in less than 1 year, it wasn't pure luck. It was the result of many years of research into RNA biology, immune responses, genetic engineering, research done not only in the United States and Europe, but also here in Canada. And there is a little part of that story that people still don't know. Many people still don't know. Canada played a critical role in developing the lipid nanoparticles, these tiny fat droplets that safely deliver the mRNA molecules into our cells. Without them, mRNA vaccines would simply fall apart before they can reach their targets. Those nanoparticles, developed in part by Canadian scientists, were the vehicle that turned genomics into world-changing vaccines. So when the world seemed paralyzed, science moved, and it moved very, very fast because information encoded in a virus's genome could be transformed into widely distributed tests, public health decisions, policy decisions, and life-saving vaccines. So for me, genomics has always been about connections between people, between data, between science and humanity. But I actually never imagined that connection will one day become deeply personal. So 2 years after coordinating Canadian National Pandemic Genomics Response, I found myself sitting in a doctor's office hearing the words no one ever wants to hear. You have breast cancer. Suddenly, I was on the other side of the genomics story, not as a scientist managing national sequencing programs, but as a patient waiting for my own genomic test results. And this time, the genome being analyzed wasn't from a virus. It was my own tumor genome. I understood in a visceral way what it means to wait for data that could determine your future, my future. Genomics was no longer an abstract technology. It was guiding decisions about my treatment, whether chemotherapy would work, whether targeted therapies was an option, whether mutations in my tumor meant a better or a worse prognosis. Here again, I witnessed the true power of genomic science, the capacity to move from fear and questions to clarity and understanding, from a one-size-fits-all approach to a truly precise and personalized medicine. I was privileged to have access to several genomic tests, but I kept thinking about women in remote and rural regions, in indigenous communities in Canada, and in low and middle income countries. Will they have access to these genomic tests? Will they have access to these advances in precision health? Cancer treatment is changing today because of genomics. We no longer treat all breast cancers in the same way. We analyze the DNA, we analyze the RNA of each of those tumors. We look for mutations, we look for the molecular profile to define the treatment. My own treatment was shaped by my genomic information, and it gave me not only the right therapy, but something just as vital, a renewed sense of confidence and hope. We are entering on an era where healthcare is profoundly personal, where our diagnosis, our treatment, and even our ability to prevent diseases can be guided by our own genetic blueprint. But this information and this transformation doesn't happen in isolation. It requires collaboration. Scientists, clinicians, governments, and patients all working together just as we did during the pandemic. That same spirit of solidarity, data sharing, determination is what we need now to make precision medicine accessible to everyone, to ensure genomic innovation serves not just the privileged few, but all patients in every community across our country and across the world. Innovation is not just about technology. It is about connection, it's about empathy, it's about compassion, it's about the courage to imagine together something better. So whether we are decoding a global pandemic or decoding a tumor, the power of genomics reminds us of a simple truth. We are all connected by our DNA, by our biology, by our humanity, and by our shared future. Thank you.